And so, without further ado, it's my pleasure and honor to introduce Katie Velicha Wannenberg, Secretary of the Public-Private Strategies Institute, who's going to be our moderator today to help kick us off with some opening remarks before the rest of the presentation. Katie, over to you.
Awesome. Well, thanks, Colin. And I just do want to thank everyone for taking some time today for our business leader briefing on open enrollment and Medicare, what you need to know for your business. With more Americans choosing to work past 65, understanding Medicare isn't just a retirement issue anymore. It's become a crucial workplace conversation. And I know today we're going to have a great conversation directly from the leader of the U.S. Medicare Department Center for Medicare, but also to learn more about how you as an employer or a business leader can educate and inform your workforce, your colleagues, your family members about the importance of Medicare enrollment. We are incredibly grateful and fortunate to have Medicare's top leader with us today. She'll walk us through what business leaders need to know about Medicare enrollment, how to support your employees making those complex healthcare decisions, and where to find the right resources. As luck would have it, open enrollment began on October 15th, so the timing couldn't be better for this conversation. I do want to spend just a few seconds and thank our amazing group of partners that are committed through our business leader briefing and spreading the word on such important topics as this one. And so thank you to all of you who promote these events to your networks, who show up and are engaged on these important topics that impact business owners and business leaders. A few quick notes on housekeeping, just so folks know a few things. Today's event is being recorded and streamed, so I know there's going to be a lot of information shared. Dr. Mina Seshmani will share, but also we have Xavier Vaughn from AARP, so don't fret if you're scribbling furiously and don't catch everything. We'll send the recording out. It will be on LinkedIn, and we'll also put it on YouTube, so you can go back, you can share the link, and have this resource available to you. Also just want to flag that the Q&A button is also live for you to use. I have an opportunity to talk with Mina a little bit about some questions, but of course want to make sure that it's open to all of you to ask. And then also following Xavier Vaughn's presentation, we'll be able to ask him a few questions. I think just want to echo what my colleague Colin said, which is please take the opportunity to use the Q&A to introduce yourself, to let people know where you're dialing in from, and just general create an opportunity for folks to engage with the Q&A. So our agenda today is quite robust. Again, I'm excited to welcome Dr. Mina Seshmani, who is the Deputy Administrator and Director of the Center for Medicare at the Centers for Medicare and Medicaid Services. We'll have a fireside chat. Afterwards, as I said, we'll welcome Xavier Vaughn, Program Manager of Medicare Education at AARP, to provide an overview of what Medicare is and what employers do. I will say, I also think this is a great opportunity for all of you. Frankly, in my conversations around the country, there's a lot of people who don't understand what Medicare is, or perhaps just don't know exactly how to avail themselves of this amazing program. And so no harm in not knowing a lot about this topic. We have two fantastic experts who can hopefully ease you into it and make you feel more comfortable with understanding how Medicare works. And as I stated, we'll have a robust Q&A following Xavier's presentation. So with that, I'm going to invite Dr. Mina Seshmani again with the biggest title that I feel like anyone has in the federal government, which is she is the Deputy Administrator and Director of the Center for Medicare at the Centers for Medicare and Medicaid Services. Dr. Seshmani is responsible for policy and operations for the healthcare coverage of more than 64 million Americans in the Medicare program, with an annual budget of roughly $1 trillion. She is leading the implementation of the Inflation Reduction Act, which makes the largest change to the Medicare program since the enactment of Part D in 2003. Prior to joining CMS, Dr. Seshmani was in the leadership at MedStar Health and cared for patients. Mina, as an otolaryngologist, I actually need to know what that is because I have never pronounced that before, but hopefully you'll help clarify that for me. She's a Hopkins trained surgeon, Oxford trained PhD and economist, where she was a Marshall Scholar. So Mina, welcome.
Thank you for having me. So otolaryngology, it is
Yes.
ear, nose, and throat surgery.
Okay.
So
Oh,
open
it's
neck surgery, everything from the collarbones up, except for the brain and the eyes.
okay. Well, I learned something new today, so we're off to a great start already with that. Well, Mina, thank you so much for joining us. I just want to give you a huge shout out to all these business owners and leaders who may just be meeting you for the first time, but you are a tremendous advocate in the space of Medicare, but also I think just a deeply passionate and I think wonderful person who really does understand the importance of engaging with business owners and leaders, empowering them with information so that they can not only educate and inform their employees, but their communities. And so I just want to thank you for everything you've done over the last couple of years to prioritize the business community. It really has meant a lot. And I think it has actually allowed people to feel more comfortable to ask questions and better arm themselves with information about Medicare. So thank you so much for what you and your wonderful team has done over the last couple of years.
Well, good. I'm very glad. I mean, actually, way back when I was a postdoctoral researcher, I did research on how businesses make their healthcare decisions. So it has always been, I mean, employer-based insurance continues to be the #1 source of health insurance for people in this country. And so it's really important that we are engaging because issues in healthcare transcend whether it's commercial insurance or Medicare or Medicaid. You know, there are fundamental ways that our system does or does not work that affects everyone. So it's important that we're all working together to be able to solve those issues.
Well, I think having that double whammy of being an economist and a trained medical doctor allows you to, I think, see across the multitude of challenges and opportunities that our healthcare system does provide to business owners. So with that, which is a great segue into my first question for you, is, given the audience on today's call and those who will watch the live stream and the recording, there are a lot of employees that are Medicare eligible and are approaching that eligibility. For you, what's the single most important thing employers should be telling their employees who are approaching Medicare eligibility?
So for people who are approaching employees approaching Medicare eligibility, they definitely should go to Medicare.gov because you can get information on your Medicare eligibility, what you need to do, whether you're automatically enrolled, how you enroll, starting to get information. And you can start to get that information a few months before you turn 65 so that you are ready to go when you turn 65. But this is important not just for people who are approaching Medicare eligibility, because right now we're in Medicare open enrollment, which runs from October 15th to December 7th. And this is when anyone in the Medicare program, you're currently in the Medicare program. It's the opportunity to see if the option that you have selected is what works best for you. And I think it's so important for employers to be reminding their employees of this, because if you're not in an option that works best for your health needs or your financial needs, then the employee is not going to have their health taken care of. And we all know the detrimental impact that has on their performance as an employee. You have presenteeism, you have absenteeism, and also just that feeling of, people work better when they feel they're cared for and they feel they're valued. And so being able to say, hey, I care about you, go to Medicare.gov, call 1-800-Medicare. We are here 24 hours a day, the CMS team, 24 hours a day, 7 days a week, to support people to make sure that they choose the option that works best for them.
Yeah, I think that is so true. And also we know that, where your health situation was on January 1st might be dramatically different on October 15th. And so I think this is actually about empowerment for people to feel empowered that, they can look around and see that there's perhaps a better option for if they're dealing with increased health or, happily living a more healthier life, and they can, flex up and down on the availability of those healthcare plans within the Medicare program. So it's really important. And I do think empowering people to make those decisions makes them more confident, and to your point, feels more supported in their life, which makes them ultimately show up as a better employee. So it's a really, really strong point. I think one of the things, Mina, if I can maybe impose on you about with your whole rich history within the healthcare space, I know, and you commented in your opening remarks, health insurance is so important for small employers. And I think many of the business owners that we talk to, and I know you've been around the country talking with business owners, feel overwhelmed with the options and you're trying to make a balanced decision, which is, of course, they want to provide robust, affordable healthcare options that are accessible to their employees. And yet, there's also that cost issue. And so what maybe a piece of advice do you have for the business owners and leaders on this call today? How could they be working more closely with CMS, or how could they be availing themselves of the robust resources that CMS and HHS have to help them make those healthcare decisions for their business?
So I would say first, you are the eyes and ears on the ground. You are dealing with healthcare issues, either as an employer and you are, trying to purchase health insurance for your employees, or as an employer who has employees who might be trying to navigate the healthcare system. And it's so important that we hear from you about what is working and what isn't, to then see if there are things that we can do, either where something isn't working to be able to improve it, or where something's working to make it work even better and to scale it. And I'll give an example. In the Medicare program, not only are the improvements we make to the Medicare program key for your employees who are on Medicare, but it's also key for the health system overall, because when you have the largest payer in the country making improvements to the program, everyone else is looking at that. So, for example, for the first time, Medicare is paying for caregiver training. I'm sure that many of you as employers have employees who are taking care of a loved one when they're not at work. And being able to give them the support they need to do their caregiving will again enable them to show up to work and to live that full life. And so it's so important that you all know that, because for your employees who are not on Medicare, this is something that you can point to with a commercial plan, for example, to say, hey, Medicare is doing this, because we lay a lot of times the framework upon which commercial plans make decisions. I think another key example is, you all know better than anyone that if an employee is hungry and is unable to eat, they don't show up to work in the same way, and it impacts their health. And we are now in the Medicare program paying for community health services for the first time. This is another example of where feedback from all of you is enabling us to make sure that we're actually caring for people to keep them healthy, rather than just treating one of their diseases when they get sick. And I think you all as employers take that same approach to your employees, that you view them as people who are there with you in your joint mission for your business. So again, being able to hear that feedback, and then as we make changes, being able to trumpet that, to tell your employee, hey, if you're a caregiver, you know that there are resources that can help, or being able to guide them as well. So I think those are some key examples. The last thing that I'll say, and Katie, you mentioned that people's health needs change each year, and that's why it's important that every year for Medicare that you go and check and make sure that you're in what works best for you. This year in particular, Medicare is significantly improving too, where starting January 1st, for the first time in the history of the Medicare program, there will be a $2,000 cap on what someone with Medicare prescription drug coverage pays out of pocket for their covered prescription drugs. That is a huge change and will bring enormous financial relief to your employees who are on Medicare. However, it's only for covered prescription drugs. So it is so important that people go to Medicare.gov, or they call 1-800-Medicare, or they can find a local counselor through the state health insurance program, which is SHIP for short. So they can go to shiphelp.org to find someone local to help them. Because just imagine if you have a prescription drug that's not covered by your plan, then you don't benefit from that $2,000 out-of-pocket cost. And I think we all know what happens when people have to walk away from the pharmacy without picking up their medication. So it's so important that you, as business owners, are helping to get the word out about these changes. And at the same time, raising your voices and saying where things are in the health system are creating pain points for you as an employer or for your employees, because that's the only way that together we're going to drive change in the system.
Well, Mina, you were not prepared for this, but my parents are on Medicare, and my stepdad just told me on Saturday when he was over at our house that he went and re-enrolled or adjusted his plan, and he, of course, is benefiting from this fantastic prescription drug improvement. And my parents had planned for retirement, but they had planned for a pretty big out-of-pocket expense as it relates to a prescription drug that he's on. And now with that tremendous savings, I mean, that is money in retirees' pockets, and
Yes.
I need to know it is impacting people's lives in a tremendous positive way. And I think our goal, and frankly, I think our aspiration, is that no one in this country is denied the ability to treat themselves with the medication they need. So kudos, but I just wanted to share that with you. It is important. I talk to everyone about this because I know how it's impacted my own family. But it is really, really important that people spread the word and make sure that they are able to avail themselves of this wonderful benefit. So kudos to the team that's worked hard across the agency and, of course, across the administration and in Congress to protect this. This is wonderful news. Mina, you did touch on
Thank you for sharing that.
Yeah.
Thank you. I'm going to take that back to my team.
Please. It is really cool. And, my stepdad has become a huge advocate for Medicare now and talks about it. But I am grateful that you actually brought up a few other things about how Medicare is continuing to change, the importance of business owners and leaders to elevate things that would make it easier. But more importantly, I mean, just the impact that Medicare can have on the health industry or healthcare industry, because, as the largest provider, I believe that is a correct statement, but you'll correct me. I mean, what you do actually does have market change or impact. Are there other things that you think business owners should know? I mean, the caregiving training is huge, and we need to talk about that a little bit more. Of course, the prescription drug changes in Medicare, but anything else that you want to highlight before we let you go this afternoon?
So I would say, yes, the $2,000 out-of-pocket cap, it's so important for everyone to know about that and to go during open enrollment and make sure that they are enrolled in what works best for them. The changes we've made to Medicare, like the caregiver training, the community health services, we're paying for care navigation also for the first time ever, integrating behavioral health into primary care, just kind of emphasizing that, there are supports available. And I think the third is just to double down on how important it is that we are hearing from business owners. And alongside that, I know that healthcare is complicated. I know it's complicated, and I do this for my career. All of you are in various businesses that may not be healthcare, and yet you are trying to navigate healthcare for yourself, for your business, for your employees. I just want you to hear from me. I know how difficult that can be. We are constantly trying to make things easier to understand and provide resources that can help. It's also been huge to have partnerships, for example, with AARP, who can provide information. And our door is always open where we want to hear how we can do better. Because, my team and I can make all these changes, all these improvements to the Medicare program, and they can sit on a shelf and not make any difference on the ground if people don't understand what these improvements are and how to access them. So really it is through, public-private strategies, AARP, there are so many organizations, Small Business Association we're working with. so many ways that we want to continue working with you so that you can feel empowered alongside your employees to be able to help get the best health care possible, and so that you can focus on running your business.
Yeah, excellent words to leave us with. And I just want to thank you and your team for the tremendous work they've done. I do think it's not lip service. You've spent hours on planes and in conference rooms across the country talking to business owners and leaders about the importance of aiding, or I guess, their own education about Medicare so that they can be that important conduit. And to your point, we know that business owners are wearing 85 different hats. They're supporting their employees, they're supporting their suppliers, their family members, their community members. So I really want to thank you for taking time out of your busy schedule. We are super excited to continue this educational program, but I do want to remind people, open enrollment, October 15th through December 7th. Even if you're enrolled in Medicare right now, go ahead, take the time to ensure that the plan you have is right for you in this current stage. Make sure that you read up on the new prescription drug benefit that is being offered so that you can find some cost savings in your household for the year ahead. But Mina, thank you so much. And I feel now I have to work on my pronunciation of what an ear, nose,
of otolaryngology.
Yes, because I would have just said ENT. But thank you for making this enjoyable, and we appreciate your passion that you have for this education outreach.
Thank you so much for having me, and enjoy the rest of the webinar.
We will. Well, I just want to thank Mina again as she signs off for her time. I do know that it is important for many of you to see the face and the voice of the person who is responsible for implementing these programs at the highest of levels within our government. So thank you, Mina, for joining us. I am also thrilled that we have a fantastic partner and expert in Xavier Vaughn to help share and impart some important information and to understand what Medicare is. Now, I said at the top of the call, we have tons of conversations with business owners, individuals who feel sometimes a little embarrassed that they don't know more about Medicare. And so we're excited that Xavier, who is the program manager of Medicare education at ARP, is here to talk about Medicare. He's very passionate about this topic. I think really the best thing, or the best characteristics in a champion, is to have someone who deeply feels the importance and value of a program like Medicare. He has developed and implemented new programs at the state and national level on Medicare education. But Xavier is also a person, and he loves cooking, baking, finding hidden gems in his community, and is very active in his church. So Xavier, I'm going to flip it over to you. I do want to remind folks that we will have a little bit of time for Q&A afterwards. So please use, already see some questions popping in there. I'll go ahead and look through them as Xavier works through his presentation. Thank you, Xavier.
No, thank you for having me. And I also want to apologize if I have a coughing fit. I am recovering from a sinus infection. So I do apologize for that ahead of time. But today we're just going to go over some Medicare basics, educating your employees on what they need to know, and different resources that are available to you or you can give to your employees. So some of the common questions we'll get is, what is Medicare? What's covered? How is it different from Medicaid? When should I enroll in Medicare? What happens if I don't? And how will Medicare work with my existing health care? So your role as the business owner is to provide Medicare eligible employees with educational materials, which I will give you resources at the end that you can use. Connect employees with unbiased sources of information. Some of those resources were already mentioned earlier, such as Medicare.gov and the SHIP program. And help employer eligible employees to avoid enrollment penalties, because some of these penalties can stick with you for a lifetime. So what is Medicare? Medicare is a federal health insurance program for people age 65 and up. If you are under the age of 65 with certain disabilities, you have to be receiving SSDI for 2 years I'm sorry. In that 25th month, you'll be automatically enrolled. When you're 65 and already collecting Social Security, you'll be automatically enrolled. But if you're working, you would have to actively enroll into the program. Any age with end-stage renal disease, and then also if you have ALS. So an employee responsibility with Medicare is going to be the same responsibility that they have with their employer-sponsored healthcare. You're going to have monthly premiums, deductibles, co-insurance, and co-payments. So some people, or a lot of people, are actually surprised that Medicare does not cover hearing, dental, and vision, or long-term care. And do not get long-term care, such as a nursing home, confused with a skilled nursing facility. Those are two different things and are operated very differently. Some parts of Medicare. Part A is going to be your hospital insurance. It's going to be your inpatient hospital care, some hospice and home health, and your skilled nursing facility care. And a skilled nursing facility care, or a SNF as you may hear it known as, is if you had like a massive stroke, you need to go to get some rehab afterwards, you need to go into some nursing care. That is what a skilled nursing facility is. So it's something that's temporary, whereas a full-blown nursing home is going to be kind of there until your end of your life. So that is what the difference is. So skilled nursing and rehab is covered under Part A. Nursing home is not covered under Medicare. Costs for 24, 25 costs are not out yet. So everything you see here will be for 24. For most people, you pay no premium for Part A. As you know, we pay into Part A. And so you have to have 40 work credits in order to qualify. That typically takes about 10 years to get. So I'm 30 and I've had my 40 work credits for a few years now. So it's nothing that most people won't have. And if you don't have it, you can draw from a spouse as well. A deductible for this year is $1,632 for days 1 through 60. And a deductible can be applied again for additional hospitalizations after 60 days. Your Part B is going to be your medical insurance. These are going to be your doctor visits, your outpatient hospital services, durable medical equipment, which are your hospital beds, wheelchairs, walkers, things along those lines, and Medicare approved preventive services. The Medicare, there's a long list of preventive services that are available, whether it be cancer screening, diabetes screenings, your yearly visit, your new to Medicare visit, smoking cessation, and the list goes on. And how I like to remember hospital and medical in Part A and Part B, if you put hospital and medical in alphabetical order, they coincide with their parts. So Part A will go to hospital, Part B to medical. So for this year, the standard premium is $174.70. If you do have a higher income, so for those who make $103,000, or couples who earn more than $206,000, you would have to pay a higher premium. So you would pay more than $174. But there is a sliding scale to that. And the annual deductible of $240 per year, and co-insurance is 20% for most services. So if you were to go to your primary care doctor, you would pay 20% of that cost. Part C, which is also known as the Medicare Advantage plans, they are a bundled deal. So in this day and age, we love to bundle our phone, internet together. Even now, our streaming services are all bundled into one plan. And that is exactly what a Medicare Advantage or Part C does. It bundles your Part A and your B, in most cases, your Part D, into one comprehensive plan. And unlike with Part A and B, which are ran by the federal government, these are administered by private companies. So these are going to be your Aetna, your Blue Cross Blue Shield, United Healthcare, those type of companies. They may limit your ability to purchase a Medigap in the future. So how does it work? You have to work live in the plan service area. So just like with your employer-sponsored healthcare, it may not work everywhere. You have to be in that plan service area and use those providers. You may have to pay an additional premium. So you would have to pay that $174 and the cost of the premium. And you may have to follow insurance company rules, such as requiring a referral to see a specialist. So these are going to be your HMOs, your PPOs, going to work very similar to your current employer-sponsored healthcare. So they're going to feel very familiar to you. Your Part D is going to be your prescription drug coverage. D is for drug. It helps covers the cost of prescription drugs that you may pick up at the pharmacy. And just like with your Part C, these are administered through private insurance companies like your United Healthcare, Aetna, so on and so forth. So people who enroll in Part D will have to pay a monthly premium. They'll have a co-payment or a co-insurance, and the annual deductible is $545. And just like with Part B, people with higher incomes may have to pay a higher Part D premium. So this graphic shows you kind of the different avenues you can take with your Medicare choices. You can have original Medicare, which are your Part A and Part B, and pick up that Part D for prescription drug coverage. And it is important to note that Part D, or the drug coverage, is technically optional. But if you do not sign up when you are first eligible, then you will have to pay a penalty. So optional, if you don't sign up when you're supposed to, you'll have to pay for it later on. Or you can go the Medicare Advantage route, which combines your Part A and Part B and D into one plan. So with original Medicare, you have a fee for service in this Part A and Part B. And the great thing is there is no network, right? You can go to any provider that accepts Medicare. And you can choose to join a Medicare prescription drug plan. As I said, remember, you may have to pay a penalty for it. And you can also pick up a Medigap plan or supplement plan to help fills in the gaps that Part B does not pay for. So Medigap, it does exactly what the name suggests. It fills in the gaps or supplement your Part A and B. And these are also sold by a private insurance company. And it fills in the gaps of cost, deductible, co-insurance, and co-payments. It does not work with a Medicare Advantage plan. There are 8 standardized plans that you can compare easily. So there are plans A through N. And it's really important to note that Plan A is not Part A. Plans are associated with Medigap plans. Part A and B are associated with just original Medicare as a whole. So it's really important to buy a policy within 6 months of enrolling. In some states, you have to be 65 and older. Some states, you can get it a little younger. And unlike with Medigaps, or unlike with original Medicare, which is a federal program, Medigaps are administered through the state. So each state could have slightly different rules and laws that are associated with it. In some states, you can maybe shop around every year. Some states, you're not able to. But the reason why it's so important to buy a policy within that first 6 months of enrolling is because if you do not do it when you are first eligible, then you would have to go through a whole underwriting process. And they'll look at your health history to determine if you are eligible to enroll into the plan. And if they do accept you, you may have to pay a higher premium due to your health needs. And it does not cover prescription drug costs or hearing, dental, and vision. So Medicare and the Inflation Reduction Act. Insulin is now available at $35 per month for a covered prescription. And just keep in mind that not every insulin will be covered by every plan. You also have access to recommended adult vaccines without cost sharing. And for this current year in 24, the annual cap is around $8,000. Next year, the cap is $2,000. You can see where that can be a great cost savings for people. And not only is it capped at $2,000, that $2,000 can be spread out throughout the entire year. And so if you had to pay $500 for one of your medications, Instead of having to pay that and paying that $2,000 in the first 4 months, you can spread it out through the entire year, which will give people much more of a financial flexibility. It's also is the expansion of low income subsidy, also known as LIS or extra help, which is administered through the Social Security Administration. And under Part D, it has increased the eligibility where you can make more money and still receive those benefits. So when do employees enroll into Medicare? There's the initial enrollment when they are first eligible, either through a disability or through age. There's a special enrollment, which a lot of employees are going to use, and there's open enrollment. Initial enrollment is if employees are receiving Social Security, then they're automatically enrolled at age 65. Employees have a 7-month period to do so, 3 months prior to their birth month, and 3 months afterwards. The caveat to that is if you're born on the 1st of the month, that moves up your birth month to the month prior. For example, my Uncle Charlie was born on June 1st. June will not be his birth month. May will be his birth month. And late enrollment means you will have to pay a higher Part B and D premiums. So for employees who do not enroll when they are first eligible for Medicare, they do have a special enrollment period. And there's multiple special enrollment periods for different things throughout a person's life cycle. But for employees, they do get a special enrollment when they decide to retire. And this period is available to over age 65 employees who are currently working and covered by a third group sponsor healthcare, or employees who lose coverage either at the end of their employment or the end of their coverage, either through themselves or through a spouse. I was said earlier, we are in open enrollment. Open enrollment is October 15th through December 7th. It's the same exact time every single year. It doesn't matter if it falls on the weekend. This is the time for open enrollment. It allows enrollees to switch between Medicare Advantage plans, go to a different Medicare Advantage plan, or go to a Part D plan, or vice versa. If you have a Part D plan, you can switch to a different Part D plan, or go to a Medicare Advantage plans. Medicare eligible employees are not allowed to join during open enrollment. So if you are someone who is looking to retire, this is not the time to like, oh, this might be an open enrollment for anyone who wants to join Medicare. If you're outside of maybe your special enrollment period, this is not that time. There is a time and place for that though. So penalties. Part A is up to 10% increase for monthly premium for twice the number of years you did not sign up for. So for example, if you did not sign up for 2 years, you would have to pay that penalty for 4 years. And after that 4 years, that penalty would go away. Now with Part B and Part D, those penalties will stick with you for a lifetime. Part D, for every 12 months you go uncovered, you will have a 10% penalty. And the key word here is every 12 months. So if you go 11 months without coverage, you will not have a penalty. If you go back 12 months, then you will have that penalty. Part D is for every month you go uncovered, you would have to pay 1% of the natural base price premium. And for 2024, I believe it's $34 is what the natural base premium is. And so, for example, when I was working with the State Health Insurance Assistance Program, I was assisting an older lady who never signed up for Part D. Part D became law in 2006. So from 2006 to 2018, when I was helping her, she never had a Part D plan. So she would have to pay 144% of the national base price premium on top of enrolling in the plan. And for that year, the cheapest plan in Missouri was $15. So she would have to pay $15 and then pay the penalty. The penalty was more than the actual plan cost. So you can see why it's so important to sign up when you are first eligible. Medicare in your business. So if you are an employer who has 20 or less employees, then your employees must enroll into Medicare. The only caveat to that would be if you're in a group employers plan and someone within that has more than the 20, then you'll be fine. Then they do not have to follow these rules. They can operate as a large employee. And so if you have less than 20, then you have to enroll, then your employees have to enroll, and Medicare will become their primary. If you have more than 20 or consider a large employer, they have a few different options on what they can do. They can choose to enroll if they want to, or they can delay their enrollment, or they can kind of do a mix between the two. They can, as we know, Part A is free, so they can go ahead and enroll in that Part A plan, and then they can delay their Part B enrollment until they retire. And this slide really just kind of details those different scenarios. With a small employer, enroll in Part A and Part B during their initial enrollment. Caveat being, unless they can fall underneath the large employer. If that's the case, then they can enroll in Part A and B during their initial enrollment period, or they can just enroll in Part A and delay their Part B, or they can delay both Part A and Part B until their special enrollment period when they decide to retire and lose that coverage. And this just shows you a nice little timeline of when things will come into play. So about 6 months prior to your initial enrollment period, you'll receive an overview letter. Then you'll have your initial enrollment opens up around 3 months before your birth month, then your third party resource list, and you're gonna have final communication with all materials, and then your initial enrollment will close. Engaging your employees on Medicare. Make sure you are clear and concise in your communications. Refer employees to trusted and reputable resources, and educate employees about Medicare prior to their eligibility. So different resources. Medicare.gov is a great resource. You can create an account and go in and see all the plans that are in your area. They'll actually will pull all your prescriptions, medications for you, so you don't have to type them all in. But it is really important that you check to make sure that all your medications are correct. Make sure the dosage is correct. Make sure that the frequency that you receive your medication is correct. But all these things will play into the cost. You want to make sure you get the most accurate calculation. So once you do that, you can say if you want to search for Part D plans or a Medicare Advantage plan, select the pharmacy that you would like to see, and it will give you a list, and you can sort it through what will be your total lowest cost. So they'll take in consideration the medications you take, the pharmacy you want to go to, and the cost of the plan itself. And you can sort it through that way. Or you can also call Medicare directly, that number here. If you forget this number, don't worry, it's just 1-800-Medicare. Other trusted resources is the Medicare Rights Center, which is a nonprofit organization that provides really great resources. Here at ARP, we partner with them quite frequently. They actually manage one of our tools on our on our website, and so they're really great. Also, we have the State Health Insurance Assistance Program, or the SHIP, and they provide free and unbiased Medicare counseling. And so during open enrollment, this is when this is their busy season. You can call this number below, and based off of the number you're calling from, they will direct you to that state. So they will be able to sit down with your brother in person or on the phone and kind of talk through what all your options. They're not going to pick a plan for you, but they are going to explain the pros and cons of everything that you need to know. And also, while you're there, they will also screen you to make sure that you don't qualify for any assistance program that may help lower your costs for Medicare even more. We also have ARP.org/Medicare, which hosts our Medicare Resource Center, where you can find all the latest articles and different resources that is related to Medicare. We have a really great online tool called the ARP Medicare Enrollment Guide, which you can go and do a quick view your situation, where you can answer a few questions. It will tell you what you need to know right here, right now. But if you really want that more in-depth information about Medicare, you can go through Explore Your Guide, which is broken down to different sections with videos and a little learning modules that you can go through. We also have an online learning series that is specifically dedicated to employers and what they need. And so you can go on there, download some resources, and you can just print them out and give them to your employees for Medicare. Conclusion, and we also have a quick poll to, for you all as well. And I know this was pretty quick, but these are just the Medicare basics that you can have for your employees. Whether you are the one educating them or you need resources that can help you educate your employees on Medicare and different topics. And also, if you would like a presentation, and hopefully I'm not sick during that time, we can also schedule a Medicare 101 for you and your employees. And thank you so much for taking the time to take our poll as well.
Awesome. Well, thanks, Xavier, for all this great information. I do want to just maybe pull in a couple of questions that we got in the Q&A, because there was actually quite a few. And so I'm just going to go through these, Xavier. Some of them might be duplicative to the information, but we know that it was a lot of information. And so taking an opportunity to reinforce or just emphasize. Can you clarify a difference between employees on Medicare and employees who stay on employer-sponsored medical coverage after 65? So I think the question is, does the employees have a choice between Medicare or staying on their employee-sponsored medical coverage?
So it depends on the size of the company.
Okay.
So if you have less than 20, then they would need to enroll into Medicare right away, and that will become their primary. If we have more, then they have a much more freedom and flexibility. They can choose to enroll to Medicare during their initial enrollment period, or they can choose to delay their enrollment until they retire or lose that coverage. Or you can do a hybrid, and they can go ahead and enroll in Part A, since for most people that is free. And then later on, they can enroll into Part B once they fully retire.
Okay. And there seems to be some threads in the Q&A just related to perhaps some lapse in coverage for a whole host of reasons, either, accidentally or perhaps, just a challenging home life situation. What is your recommendation for someone who is looking to get an exemption on guarantee? Is that where the Medicare navigators can be really helpful? Kind of where would you send someone to suss out how they can proceed with an exception?
Yeah, so when it comes to Medicare and enrolling to Medicare, and if you're still working, planning is everything.
Okay.
You want to make sure that you do not have any gaps of coverage. So you really want to start looking at this a few months before you plan on retiring. And this is when you can go and talk to the SHIP program, which is local people in your community. It could be your neighbor could actually be a SHIP counselor. You just don't even know it. And they will help guide you through it. This is one of the reasons why we have these kind of presentations, right? Where we can make sure that your employer, as an employer, that you have these resources available, for we don't have any gaps of coverage for your employees. And so if you have any questions and you have lapse of coverage, go into your SHIP, maybe searching online through ARP resources, the Medicare rights resources, different things. Those are going to be the most important things that you can do.
And we'll include the links to the SHIP resources when we blast out the recording of this to everyone who registered, so that it will be in the email so that you can source that as well, along with all the rich resources that ARP provides as well. Xavier, is there a cap on the 20% copay, or is it 20% no matter what?
It is 20% no matter what, if you are enrolled into original Medicare and that's all you have. So
Okay.
This is why people enroll into Medigap's
Okay.
or supplement insurance, whatever you would like to call it. It helps protect you from that 20%. So for example, if you get enrolled into a G plan, which is one of the top tier plans you can enroll in, the only thing that you would be responsible for would be that $240 Part B deductible. And once you pay that, and everything else would be pretty much covered if it would fail under Part B. So if you were to have a massive heart attack, it would go into the hospital, $240 would be pretty much all you would pay, and then everything else would be covered. Or you can go with the Medicare Advantage route, which can have an out-of-pocket max. And so what I like to tell people, your Medigap are going to be more expensive upfront. It could be $100 to $200 of a monthly premium. But if you know if you are a high utilizer of your health plan and out of the hospital, do you want to pay that cost up front with your monthly premiums with your Medigap, or do you want to pay it at the end with that out-of-pocket match, which could be $10,000? So these are different things you have to think about and really think about what you can financially afford.
Okay, great. And I just want to confirm that the 2025 premiums and deductible rates are available now during open enrollment, correct? Or is there a different time window that those will be published?
They will be published sometime before. It should be any day now, but they
Okay,
are
so
published as of yet, the 2025 cost.
okay, perfect. And I just want to reiterate, because there's quite a few very, I think, lovely comments in the Q&A, just people wanting to be armed with more information and resources. We will share the recording of this webinar. We will also include a lot of educational links that you can share with your employees, your friends and family on Medicare. And so I really do appreciate the sentiment that many of you have expressed in the Q&A about wanting more information so that you can be more comfortable or direct people to good resources on Medicare. There is a question, I think maybe a clarifying question about if someone's retiring, say in January 2025, they should sign up for Medicare during this open enrollment period, or no?
So they will be signing up using their special enrollment period that just coincides at the same time
It
as
just happens to coincide right now. Okay.
Yeah. So it has nothing to do with it being with open enrollment.
Okay, because it's the 6 months before, right? You can sign up 6 months before, is that correct?
Correct. So it's really focusing on the special enrollment and not open enrollment.
Well, okay, got it. Okay, well, I just want to be cognizant of time, Xavier, because we're bumping up right onto the hour mark, and we've had a lot of people join us and participate. So I just want to just give you one more opportunity to cover anything that you maybe didn't touch on or want to re-emphasize before we close out today's session.
Yeah, so just a reminder, right now we are in open enrollment. That is for people who are already enrolled into Medicare and they should shop around. Even if they are happy with their plan, this is the time that they can shop around and get a plan that may be better for them. People have said, I saw my Facebook memory, I saved someone multiple thousands of dollars because they shopped around. So shop around. If you do not sign up during your open enrollment period, there is what's known as a Medicare Advantage open enrollment period, which is January through March. So if you're on a Medicare Advantage plan, you can shop around during that time. If you miss your initial enrollment, you need to enroll into Medicare, then you can also do that January through March, and your coverage would begin the following month. Also, don't forget all those really great resources that are included, and I know you will be sent those a little later on. Please use them. And also a reminder that if you would like a presentation for your employees, I am more than willing to do a Medicare 101 presentation for them as well.
Awesome. Well, thank you, Xavier, for that offer. I just want to thank everyone who was able to join us this afternoon, and hopefully feel like we have armed you with more information and resources to support your own Medicare journey or those that you employ and those family members that you support. Just really, and thank you for the robust Q&A. It was great to see that. Not to sound like a repetitive robot, but remember, we are currently in open enrollment, which began on October 15th and runs through January 1st. So please make sure that you visit cms.gov, medicare.gov to learn more about open enrollment. And also and Xavier, correct me if I'm wrong, but if you're within that 6-month window of retiring, please make sure that you are getting enrolled, understanding the benefits packages that are available to you through Medicare. And of course, I do want to thank Mina and Xavier for being here. As you can imagine, having the head of Medicare join us was a special treat. And we're so grateful for Mina's expertise and passion for educating and informing business owners and leaders on Medicare and how it is a crucial program for the 65 plus community. Again, want to just reiterate, we'll be sending up a follow-up email with the recording of this with tons of resources and information. So don't stress out. You can either rewatch this webinar, or you can click through the plethora of educational information that we'll be sharing in our follow-up email to you. And so with that, I'm going to conclude today's educational webinar, our business leader briefing on open enrollment. And thank you all for joining us this afternoon. Be well and be safe.